Echo of a 60 years male patient. Yeah, he got exertional shortness of breath and chest pain as well for 6 months. And echo shows there is a slit-like appearance of the LV cavity due to thickened interventricular septum, especially interventricular septum, but posterior not too much thickened. If you compare with the posterior and interventricular septum around 23, 20, 23, 24, something like that. But the posterior inferior wall only 11. Patient is normotensive, non-diabetic. So it's a genetic hypertrophic cardiomyopathy, non-obstructive variant. There is no obstruction, but there is a obstruction, the mid cavitary obstruction, but not any significant gradient. No, gradient is not too much low. It's not normal, I think. 15 millimeter of mercury. So there is a mid cavitary or apical part is obliterated during systole. So again we like to measure, there is a gradient. (24, 25). So significant gradient. There is a significant gradient in the intracavitary of the left ventricle near the apex. So there is a also shiny appearance of the interventricular septum is also posterior. It may be the hypertrophic cardiomyopathy, genetic autosomal dominant genetic variant, or it may be infiltrative cardiac disease, sarcoidosis or amyloidosis, something like that. So we can confirm by CMR or GLS. So just this is the 2D measurement of 2D evaluation of the echo. So it's no doubt at all there is asymmetrical septal hypertrophy and there is a mid cavitary obstruction of the left ventricle, and cavity is too much reduced, and there is a obstruction in the near the apex and gradient around 24, 25, but there is here not so much gradient. It's normal. So our LVOT gradient is normal, just only intracavitary, and there is no regional motion. And this is the ECG of this particular patient. This ECG, there is a symmetrical, some are asymmetrical TOV inversion in the chest lead V2O, V6, and also left ventricular hypertrophy. And there is a tall R in V6 and tall S in V1. The summation of these, there is a more than 35, and there is a T inversion in the 1 AVL as well, and also inferior lead. So this is the typical ECG of left ventricular hypertrophy, or it may be systemic hypertension, or it may be hypertrophic obstructive cardiomyopathy, or it may be hypertrophic cardiomyopathy. It may be the patient of acute coronary syndrome. It may be patient of chronic coronary syndrome. So this ECG without getting any history, so many differential diagnoses. But when we see the echo is changed, there is a interventricular septum is significantly thickened near the apex. So this is the hypertrophic cardiomyopathy apical variant. So thank you all. Thank you very much.